Next weekend, hundreds of medical leaders will gather in Chicago for a conference focused on addressing gender disparities in healthcare. It's called the Women in Medicine Summit, hosted by the nonprofit organization Women in Medicine. And joining us now is the founder, Dr. Shikha Jain, also from the University of Illinois Cancer Center. Thanks so much for being with me this morning.
Thanks for having me.
We greatly appreciate it. So you founded Women in Medicine in 2021 to address a gender gap in healthcare. So what are some of the differences that you have noticed that made you want to start this nonprofit?
So our first summit was actually 2019, then the nonprofit came about in 2021. And the reason this all started was I'm a physician, and I realized a lot of the challenges that I was facing in my career were very similar to what other women faced, regardless of their specialty, regardless of their level or their year. And so I wanted to bring together women and allies from around the country to not only discuss the problems that exist, but also figure out ways to create systemic changes within our healthcare system to make sure that we're driving change to not only improve the workforce, but also impact the care that we are delivering, because there's a direct correlation between women in leadership, and especially women of color, and those healthcare outcomes that we talk about so much.
So what specifically type of work does your nonprofit do, and how are you looking to empower women?
So we do all sorts of things. We have leadership programming for early and mid-career women. We have a speakers bureau to help elevate women, to get them on the news, to get them research opportunities, to get them seen as national and international thought leaders. We have allyship programming for male leaders to help them become more inclusive leaders in this current climate. We have this annual summit that we host that happens in Chicago every year. And a lot of it is not only education, but we also create these networks to help people get those opportunities, because at the end of the day, we don't need to fix the women, we need to fix the system, and we need networks and support systems to make that happen.
Right, so it's an all-encompassing effort. A recent study in a journal published by the American College of Physicians compared health outcomes for patients based on the gender of their physician, and the research found that patients treated by a female physician had lower rates of mortality and hospital readmissions than if they were treated by a male physician. So what is your take on this research?
Well, I think it's really important to note that this is not an us versus them. This is not men versus women. This just shows that women are phenomenal clinicians. Women are phenomenal healthcare providers. So when all of these women are leaving healthcare because of burnout, because of bullying, because of pay disparity, because of leadership gaps, it's really a problem. And so when we talk about health outcomes, the health of our communities is directly impacted by keeping women not only in healthcare, but also promoting them into leadership. So all this data shows me is what we know. Women are phenomenal physicians. Women are phenomenal nurses. Women are great at taking care of patients. We need to make sure we are providing ways to keep women in the healthcare system and then elevating them into leadership.
Data aside, I have to ask, I'm going a little off script here. Why? Why are women better at all of these things you just mentioned?
Oh, that's like a 25 to 30-minute segment. But what I can tell you is part of the reason that's been found is oftentimes women are more collaborative when it comes to the way they are working. Oftentimes women are more willing to ask for help or ask questions or admit when they don't know the answer to something. There's also been data that's shown that women spend more time on the electronic medical record, so they spend more time answering patients' questions. So again, it's not that women are smarter, it's not that women are better, it's just that there are often stereotypically different ways that women function and work.
A different approach.
A different approach.
So really quickly, because you've got like 5 seconds, 5 things or 3 things people should look for when choosing a doctor.
So you need to look for somebody who, I call it like dating. You need to make sure it's somebody whose personality jives with yours. You need to make sure that they answer your questions, they take the time to answer your questions, they're not dismissive, and that they're open to having a shared decision-making process as opposed to them just telling you what to do. And then finally, you need to be comfortable sharing intimate parts of your life with them. So again, that's why it's kind of like dating. You've got to find the right doctor.
Right, and if it doesn't work with one, you'd move on and find another.
Absolutely.
All right, Dr. Shikha Jain, thanks so much for joining us. That is really interesting, and we appreciate you being here. To learn more about Women in Medicine and the summit, head to womeninmedicinesummit.org.